Hello, everybody. I'm Marylene Duah. I'm an infectious disease specialist at Samaritan Medical Center. I've been working here for over 15 years, and I've been part of the North Country for over 22 years. As you all know, we've heard a lot from Dr. Fauci about how to prevent spreading the illness. And you all know that New York State is the most heavily affected state, and Jefferson County has done very well. So we trying to keep those numbers as low as we can. It's all a work of all the community together, physicians, healthcare providers, patients, everybody in the community has to work together to stop that pandemic and decrease the mortality as much as we can. So things that you can do out in the community is definitely wash your hands as much as you can to prevent the spread, at least 20 seconds anytime you're in public spaces, anytime you touch surfaces that may be dirty, using hand sanitizer or soap and water. You definitely want to cover your sneeze, cover your cough with a tissue or with your elbow if you don't have a tissue, and wash your hands. When you're outside, if you have to be outside, just for emergencies because you have to go to the grocery store or to a pharmacy. These are the really only reasons that you have to be outside in a public situation. Try to cover your face with a mask, a cloth mask that you have at home. A bandana could do it so that you do not get exposed to anybody who may have COVID, or if you may be a carrier yourself and you still don't know it, you don't expose anybody else. So we have to protect our immunocompromised patient, especially the elderly, because the mortality is very high in that group of patients that are hospitalized, could be up to 15% in the elderly. So to protect your loved ones, you need to stay away from the hospital and visit them on their telephones. And if they do not have a smartphone, they cannot visit with you. Our nurses have done their best to have you visit with them through their smartphones. So the difference between COVID-19, obviously, and the flu is COVID-19 does not have any vaccines yet. Hopefully, we will be having one in maybe a year. There is no treatment for COVID-19. There has been few experimental medications that we have been using, but we have no treatment. There's also been a lack of personal protective equipment, so we are trying to prevent spreading the disease to our healthcare workers who have been ill also from the disease. So what we need to do in terms of that social distancing is to decrease the number of infections. That way we're not overwhelming our hospitals with too many cases at the same time. So even if we have one or two cases, we can take care of them properly, hoping that there will be enough personal protective equipment, and maybe some more medications will come out or some more studies showing us what else we can do to help save your loved ones. Really, it is our whole community's job to make big sacrifices for all of us to stay healthy and not have any mortality if we can in Jefferson County, and decrease the mortality in New York State as a whole and then the world as a whole. So to fight this pandemic, it is a whole community. It is all of us fighting. So to all the Jefferson County residents, this is hard on everybody, but I know we can do it all together. We have hope. We've had very few cases. We've had no mortality. Please, let's all be strong community and keep it that way. And this disease, we will overcome it.